Um, some of you may know that we were supposed to have Dr. Lawrence Sherman join us today as our HCP keynote. Unfortunately, Lawrence could not make it today. And so at the very last moment, Kent Bottles here volunteered very kindly to come in and present and talk to us about social media and using it to connect. And I think with his experience just all across healthcare, it's kind of a really nice way to end this day today, and to hear from him. I know there's a lot of people here that know Kent very well, and I'm very excited because it's actually the first time we've actually met too.
Yep,
so following him on Twitter for a while, and really enjoy everything I've heard. So very excited to hear what you have to say in real life.
Thanks, Schwinn. So I got a panicked email yesterday from Schwinn asking if I could come down and give you some talk. I mean, you're probably as overwhelmed as I am. I've been here all day. And so I guess I'll quote Jack Welch: if you're not confused, you don't know what's going on. But I feel sort of like, sometimes you feel like the token patient at a medical convention. I feel like the token doctor here. And when I told my daughter that I was coming today, I said they needed a pinch hitter. And so she said, well, you know, Dad, pinch hitters hardly ever get hits. And so I said, well, maybe I'll be a closer. So that's just a segue to talk about the Philadelphia Phillies, who have the best record in baseball. So welcome to Philadelphia. Take a deep breath, because I'm really only going to try to go over two things. And I realize I'm the only thing standing between you and liquor, which although she listed it as a problem for non-communicable diseases, still seems to be quite popular with most of us. And so this will be informal, and please feel free to interrupt whenever you want. The only two things I wanted to go over were patient advocacy, and we heard a great example from Clariant today, and thank you for lunch, a delicious lunch that actually seemed fairly nutritious. I'm going to talk about patient advocacy groups and healthcare, and then want to talk just a little bit about Care Coach, which I'm the chief medical officer of, which is a biotech startup here in Bucks County. Patient advocacy groups. How many people here actually work for a patient advocacy group? I know there were some before. I guess they've left. What are the goals of patient advocacy? Really just public awareness about the disease, treatment, self-management, professional awareness of the latest studies. And we've learned today that doctors don't always know everything they should know. And that's a dirty little secret. If you think about it, someone who's really, really committed to their disease and learning about their disease and how it affects them is going to know more than I do, no matter how specialized a doctor I am. Because if you're an endocrinologist, there's the thyroid and the adrenal gland and a whole bunch of stuff. But if you only have one disease with one enzyme, you're going to know a heck of a lot about that. And yet we doctors, I'm ashamed to say, don't always admit we don't know what we don't know. So that shouldn't surprise you. Getting treatment covered by insurance, we talked about that in Clariant. But just remember, our biggest goal, if we're going to have an economy, if we're going to have jobs in America, is to decrease per capita cost and increase quality. So you really can't pay for everything unless there's some kind of return on investment. And to be honest with you, my personal opinion is we're going to have to go to something like the NICE in England, where we don't pay for everything if it hasn't been proven to work. And that we have trouble with that in America, because some people use that to say rationing is a bad thing. Encouraging research into the disease and advising regulators to make sure that the the treatment is monitored, safe, effective, and affordable. This first talk actually was, I guess I'm a well-known pinch hitter or closer, because about 2 weeks ago, I was called up the day before a conference where I was giving a talk and was said, we're in a panic. I know you're giving one talk on having doctors engaged with social media, but the person talking about patient advocacy groups just bailed out. Can you give another talk? Most professors, like I used to be, and most doctors think that they can talk about anything. So sure, no problem. And then I realized I had less than 24 hours to create a talk I've never given before. So this is kind of an interesting experiment. I mean, I'm not nearly as knowledgeable about social media as all you all are and stuff, but over the years I have a little Twitter following, and I tweet every day, one of the few doctors that do. So on a Sunday, I tweeted, help, exclamation point, need best practices of patient advocacy to give talk tomorrow in Long Branch, New Jersey. Sunday. Well, before Monday morning, it was interesting. I got 34 responses from all over the world with more than enough examples of social media use by patient advocacy groups to fill up half an hour, which I thought was pretty cool. And I guess that one of the things I take from that is, and I appreciated the talk today about that the social media communities that we have for doctors don't get it quite right. That fellow was talking about it. Because I think he's right, because the only reason I was able to get so much knowledge in less than 24 hours was that I've organically grown a community that they know that every day I'm going to tweet the New York Times, the Wall Street Journal, the Philadelphia Inquirer, and everything I get on my RSS feed about healthcare. And when I don't tweet at 5 a.m. on Sunday morning, I hear about it, which happened last Sunday. I slept in. My apologies if you follow me, but I got 3 tweets saying, "Where are you?" And it was 9 o'clock in the morning on a Sunday, and I was like, give me a break. But the point is that I think social media really can't be a community that you create for each drug campaign, or you can't create to market a project. It's really got to be an organic community where they get something out from me, but when I say help, then they help me back. So I was impressed that I got 34 responses that you're now going to see. And the funny thing was that on that Monday, after I gave my talk, I was doing a breakout session, and my phone rang. For some reason, I answered it. It was another social patient advocacy group saying, "We've got some more stuff we want to share with you." So I actually put the speakerphone on at the breakout group, and we had a discussion. So it's that just-in-time knowledge that you can get if you have a community that cares about you and if you actually provide some value back to them. Does that make any sense? Or okay. So what the people who talked to me said, the Autism Speaks in their annual Light It Up Blue campaign. They decided to have a website, campaign-specific website, long-term promotional agreement with Toys R Us. They got a Facebook page and got Toys R Us to have lots of people, and they put new features on it. American Cancer Society got very excited and sent me a bunch of stuff talking about their advocacy in a Aware book, their new diagnostic social network to connect newly diagnosed patients with other patients. I talked to them about, is that really necessary? Isn't there ACOR? But it seems like a lot of people want to have their own social media site. I'm not so sure we need so much duplication, but that's just my personal feeling. Interesting about the Avastin thing. I don't know if you followed this, but the FDA Avastin ruling whether Avastin should be approved for use in breast cancer. Although from a evidence-based medicine, which is my background point of view, there's no evidence that it works for breast cancer, but lots of people want it. And I think you heard that today at noon. Well, there's nothing else we can throw at this patient, so we ought to be able to use that drug. But what I found interesting about this was that Terry Calley did an integrated PR strategy that used social media, and they said if the FDA withdraws approval for Avastin as a breast cancer treatment, insurers and Medicare might not cover the costs, even though doctors can still prescribe it. I can prescribe stuff for anything off-label. It doesn't mean that we have any evidence that it'll work. So I have my own opinions about that. But they did a really interesting campaign to get patient advocates for Avastin for breast cancer in front of the FDA panel. They used different companies that you know far better than I do. They had an integrated campaign that was talking about they wanted to get to breast cancer patients, families of breast cancer patients, physicians, lawmakers, and the news media. They used a Freedom of Access to Medicine's homepage, and they also used a lot of LinkedIn, Twitter, YouTube, and Facebook, and had a very robust campaign that got a lot of attention, and the FDA panel actually did not agree with them and said that it shouldn't be used for breast cancer. So whether you agree with that decision or not, this was, I think, an interesting example of a very effective social media campaign that got the patient voice out there. So LinkedIn, Twitter, YouTube, Facebook, what should you use it for? Well, describe physician-patient discussion on drug access, real-time update of meetings with policymakers, promotes the mission of the foundation, thanks supporters for sharing testimonies. So you all know that far better than I do. Freedom of Access to Medicine blog, they really thought there was some benefits for that with the long tail search, number of index pages and stuff that you know far better than I do. I'm not a data person at all. I'm just a simple doctor. So this was another one, the National Fibromyalgia Association project that called me up and sent me lots of emails and got very excited. Their challenges were that they were an important website, an important group, but they didn't update their website regularly. They had no interactive features on their website. They didn't have much staff. They weren't really clear on what their function was. And there started to become a lot of negative information online that they weren't responding to. So these folks put together a goals, which was to build a positive image for the association, respond to negative information online, share news in real time, create new advocates, increase subscriptions, and fundraise. And they were quite successful by, again, I think, not just using social media, but using it as a tool along with lots of other things. And I guess that's one of my, as not a real social media expert or anything, social media is just a tool. I mean, it's no big deal. And I get kind of chagrined when I'm asked to come and talk about, to a lot of conferences, well, how can we use social media to get doctors to do this or that? It's just one tool of many. And what I like about this campaign was they had a lot of free lectures by physicians who treat the patients, one-on-one. It's similar to what Clariant talked about at lunch today, I think, was that they're going to have a whole bunch of different things that they're going to do. Community walks to get people involved, a petition to local governments to declare a day as National Fibromyalgia Awareness Day, fan pages on Facebook, and then lots of open houses. So again, as I think you know better than I do, it's just one tool of many in terms of doing that. But if you actually kind of think about what you're doing and get organized, you can increase your fans from 2,000 to 10,000 in a couple weeks. Your daily average page views went way up. They got media coverage. And they started to actually be able to get their message out to combat or at least talk about the negative messages that were coming out from lots of other people. And they increased the number of donors. I think one thing that maybe we haven't talked about today, at least I wasn't here for all of it, but for most of it, was that social media is a great way to recruit patients to clinical trials, which I'm interested in, because I still believe that we should only pay for drugs that actually has been shown to work, which I know is a radical concept for some of you. That was sarcasm. Did you catch that? So anyway, so sponsors need to think of patients as partners in clinical trials. Patients like me, I think we all know very well. Patients like me has a really good click-through rate, and sponsors need to engage patients in conversation and play by the rules of the gathering place. And I guess that's my biggest message is, I think that social media sites or your Twitter feed is really great if it's organically grown, and if you're working on it every day, show up every day and add value, then people will help you. I mean, another example of when social media is just me as a physician executive, it's helped me. I was going to give a talk, actually facilitate a board retreat at a hospital in Colorado, where the doctors didn't want to adopt an electronic medical record with CPOE, and the board wanted them to. So they had a big retreat where I was supposed to come and be the facilitator to say you need to do this. They wanted a pre-conference white paper that would convince the doctors why this was a great idea. So I sent them one, they didn't like it. I sent them another one, they didn't like it. I sent them the fourth one, they didn't like it. And at this time, I'm like, there's a couple weeks left, what am I going to do? So I put out on Twitter, help. I need a white paper to convince doctors that health IT and EMR and COPE is a really good thing. Immediately, Brian Aher, who's far more famous than I, who I've never met but talked to on the phone several times, Kent, I'm right on it. So he sends me a direct message on Twitter. I send him my email address. He sends me 5 white papers I never heard of. I grab one without reading it, send it off. They loved it. So again, for someone like me that's nobody, that has really not very pretty slides, Twitter is my research department with really smart people like Brian Aher, who is part of my community, who I've never met, but someday I probably will. And probably today what's been great, Schwinn, is like, actually I've met several people that we follow each other on Twitter. There's one back there, there's one over there. It's kind of neat to meet people that I've never met before, but who have really taught me a lot. Ed Bennett was one of my mentors. I think Phil Bauman is next to him, was one of my other mentors, who I never knew for a long time. So that's kind of a neat thing about social media. So patient recruitment, I think you can really use social media for clinical trials, and I think that's a really, really important thing. The other thing is funding mechanisms. For a lot of rare diseases, it's hard to get doctors like us to really take them seriously because it's not a really big return on investment for drug companies, and it's hard to get those kind of things going. And I certainly am not sure that multiple sclerosis is caused by malformed neck veins and treated by surgery. I think probably it's not, but there's an Italian surgeon who says it is. And what's interesting in Canada, the patients really embraced this theory, used a lot of ways, the social media campaign, to really put pressure on the Canadian government to do something I think is really good. They got money to say, well, let's do a trial and see if it works. I'm pretty sure it won't work, but sometimes we get things wrong. So different Canadian provinces pledged a bunch of money, and they're actually doing the trial that will tell us whether it works or not. So again, a great way to use social media. The next thing I want to do, so that's kind of that's probably more than I know about patient advocacy groups. I know that someone who knows a lot more than I did just came back in. So patient advocacy groups are really, really important partners, I think, for all of us to think about, especially to me, the ones that are dealing with diseases that aren't that common. I want to segue just a little bit to another topic that's near and dear to my heart. And for full disclosure, I am the Chief Medical Officer of CareCoach.com. But what really bothers me is that all day today, this has been a strange conference for me because there's very few doctors here. And I realize that most of my brethren would violently disagree with almost everything that's been said today. And so that's a weird, I'm a stranger in a strange land here. And so, but we all know, because we've all been patients, that the doctor-patient relationship's, one, really important, and two, it could really be improved in most cases. And there's all sorts of studies that have been done in peer-reviewed journals which say that newly diagnosed cancer patients really only remember 50% of what the doctor told them, and they really get 50% of what they do remember wrong. That's kind of a problem, I think, if we're doing evidence-based medicine. And so Verilog, which is a company in Bucks County, which has actually got about 50, 60,000 now recorded conversations between doctors and patients that they use linguistic analysis on, got the idea that we really need to improve this doctor-patient relationship in the office. And so their idea was, well, maybe we can have a new app, since we know that there needs to be a lot of improvement in this dialogue, because they noted, their linguistic analysis noticed, and this is going to shock you, that there's a 4-to-1 talk ratio, that doctors talk 4 times as much as patients in an encounter. Now, that doesn't shock anybody in this room, but it's not very helpful in terms of actually getting patients to be empowered. And we actually know that empowered patients become activated, and we have a whole bunch of studies that for a variety of different diseases, an activated patient actually has much better outcomes. So that's important to do. So basically, their thought was, we've got to improve that, and they created CareCoach. And so what CareCoach is a website, but also an iPhone app and an Android app that helps patients prepare, do their visit, and then have the post-visit. And when we say prepare, what we're really talking about is giving patients the confidence to say, I'm in the driver's seat, and here are questions that I want answered by my doctor. And we've seen a bunch of data. I think Jane just showed some, and I think the Manhattan research lady showed some, where this is what people want, and yet they don't have the confidence to really confront the doctor and say, I want this. So how do we fix that? Well, on this website, which I won't bore you with, but you can go to carecoach.com and take a look, you can actually listen to and see the transcripts of patients having real dialogues with their doctors with the same diagnosis you have. And so you can learn, well, what's the doctor going to ask me? What should I ask the doctor? And so, you know, every advocacy group is starting to create lists of questions you should ask if you've been diagnosed with this disease. So basically, and one of the co-founders of CareCoach is Jameson Barnett, has a great story that his mother-in-law got lung cancer, and so they had a care team of 8 people, and Jameson listened to 25 Verilog conversations. They're anonymous, so he doesn't know who they are, but he really got a good idea before they went to see the surgeon. Well, what should we ask? I mean, because when you get a diagnosis of cancer, it's hard to get your act together and know what you're supposed to do. So part of the CareCoach platform is to prepare you to know what questions you should ask, know what questions the doctor's going to ask, and if you want, look at transcripts or listen to conversations of a patient like you. Then, with the cell phone app, you can record your conversation with your doctor, which Dr. Oz said we should do and Don Berwick says we should do, and most doctors say no. So that's a big barrier, is to try to get doctors to say there's nothing wrong with being transparent, and it's a good idea to have the recording of this conversation. And then maybe more importantly, and I'm really glad I came today, because I got some more evidence that caregivers are really, really important in taking care of us. I mean, most of us, both my parents have passed away, but when my parents were sick in Seattle, I was president and CEO of ICSI in Minneapolis. And so it was very difficult for me to go to every doctor's appointment. But think if I'd had a recording, an audio recording of that visit, I could have actually known what the doctor had said when I'd asked my mother, well, how many pills did he want to give you? I don't remember. And why are they giving you this drug? Because that doesn't make sense to me. So we're really going to have a transparent ability to record the conversation. And you all know of the Robert Wood Johnson open notes thing in Harvard, where they've had some experiments that letting patients actually read the notes that we doctors write in the medical record. So after you have your recording, then if you have people you want to share it with, whether they live with you or without you, you can use the email and actually share the recording with them so they can, even if they live across the country, can know what happened at that doctor's visit. And this really did all come out of Jameson Barnett's experience with his mother-in-law, who was diagnosed with cancer. And the one time they didn't record a conversation, there was a lot of confusion among the 8 people helping to take care of his mother-in-law. Well, what really was said at that meeting with the doctor? A lot of confusion. So that's kind of what they're talking about, is that it's really important that patients have a sense of what's going on and become full partners. And so you've got a cell phone app, a smartphone app that you can, listen to some stuff before the thing, keep track of the questions you want to ask so you have it right on your cell phone when you go see the doctor, record it with the doctor. It's then all uploaded in a safe way and it's HIPAA compliant and all that. And then you can share it with people that you want to share it with when you go home to your loved ones. And so I think this is, to me, the really biggest thing. And I wish I'd had this when my parents were sick in Seattle and I was trying to monitor and I was the only doctor in our family. So, I get the phone call from my banker brother, hey, Kent, I don't know if this is important or not, but Mom's got a prolapsed mitral valve and a huge murmur. Is that a problem? I'm going to be on the next airplane. I'll be right there. And so I get to Seattle, and I go to Mount St. Elsewhere Hospital, and my mom's in the ICU, and nobody's there. And so I watch her get sicker and sicker and sicker, and I'm a pathologist. But when I grab a stethoscope and can hear pulmonary edema, it's pretty bad. And so I call the nurse and say, please come, and, oh, don't worry your pretty little head. Your mom's going to get cathed tomorrow morning. So I sit there, and then my brothers come in, and starting to get kind of angry, and my brothers say, well, you can't tell them anything because then they won't take good care of Mom. I said, trust me, I kind of know this space a little bit. So I call the nurse back in, and she says, no, I can't call the doctor. So then I whip out my business card that says I'm a doctor and president and CEO of an institute. Oh, why didn't you say? And so I get the doctor on the phone, and he's at a different Mount St. Elsewhere hospital because there's only one cardiologist covering 4 hospitals. And he says, don't worry your pretty little head. We're going to cath your mom in the morning. And I finally said, well, can you just spell your last name? Because she's going to be dead by tomorrow morning. I want to know who to sue. And, oh, I'll be right there. So he comes in, listens to my mom, looks at me and says, she's in pulmonary edema. Why didn't you call me sooner? So my brothers grabbed me before I hit the guy. But, this is a true story, and this is like life. And Don Berwick is right. If you ever get sick, you better have a nurse or a doctor there 24/7 with you. And the last part of that last story, and sorry, I wasn't going to talk about this, but I am now, was, well, they cathed her. Your mom needs emergency valvular surgery, and we're going to send her over to Mount St. Elsewhere Hospital number 4 because we have a contract with them. How many mitral valves a year do they do? I think they do about 12. Is there any place in Seattle that does more than 12? Yeah, Swedish does 2,000 a year, but we don't have a contract with them, so your mom's going to Mount St. Elsewhere Hospital number 2. So again, I've got a rental car, so if you won't transfer to Swedish, I'm checking her out AMA and I'm driving her over in the Hertz car to Swedish. You can't do that. You want to bet? My brothers are then saying, you can't do that, Kent. But, we ended up at Swedish, and she had a mitral valve repair and had a really good outcome. But again, everybody in this room has a story like that. Raise your hand if you have a story that's like that or sort of. Look around the room. We're all going to be patients someday. So I think transparency, I think all the stuff that we've learned today is really, really important. And I think those three barriers that Jane just talked about, it's not going to be easy, because I can tell you, most doctors don't want to have you record your thing. Most doctors don't want to, aren't there yet. So we've got a lot of work to do. And then I guess that's the last thing, and then I'll open it up to questions. I've often thought about, well, why is it so hard to get doctors to engage in quality kind of things, or to engage in change, or to engage in, just recording a conversation with their patient? And I think I figured it out now, because I do a lot of work in this space of trying to get doctors to do something they don't want to do. You have to reframe doctor anger and doctor anxiety. It's not anger, it's really vulnerability. There's a whole new world out there that we didn't. I've had one doctor tell me, I didn't sign up for this cruise. I was told, I got to medical school, I got board certified, and I was guaranteed $400,000 a year for the rest of my life. And it just ain't so anymore. So I think I've gotten to the point where I can actually cut about 4 hours off of my sessions with doctors if I reframe all their anger at me for bringing in the ACA, bringing in social media, bringing in things I think they have to do, and realize they're just scared. And doctors aren't very good at saying this simple thing: I don't know, and I need help. And I'm not very good at, iPhone applications, and I'm not very good, I don't even know what Twitter is. So I guess that would be the one thing I'd say, is that doctors need our help as well, but they're kind of hard to help because they don't really want to admit it. And I'm a doctor, so I can say that, so trust me. I'll just end there, and we'll see if there's any questions. And if there aren't, we can all go drink red wine.
You know what e-patient Dave would say is, let patients help.
Yeah.
Anyway, thank you very much, Kent. That was
Thanks.
awesome. Any questions for Dr. Bottles?
I will be happy. Are there any other doctors in the audience? Well, I will be happy then to speak for the entire 800,000 doctors in America and tell you what's what.
No questions?
There must be a question or two.
Meredith.
Yes.
Oh, sorry, the Manhattan Research lady. Hold on.
What is the, I'm embarrassed I don't know, what is the legality, or do you have any leg to stand on if you want to go record? Because I've been shot down twice myself as my N of 1.
It's probably not, again, it's always difficult because you really don't want to alienate the guy or gal that you need to talk to right then. But I think, read Don Berwick's article in Health Affairs, if we truly believe that the patient owns their medical record, we're kind of in a funny zone, but I truly believe the patient owns their medical record, and yet Jane just showed you that Medtronic, maybe they do now, but they haven't in the past. We're at a transition zone where we really got to work on that. But that's kind of why I feel good about working for carecoach.com in the terms of, I think we've got to get there. And I'll give you an analogy that I've been reading. I read a lot of stuff. When police cars first had cameras put in police cars, the cops hated it. This is awful. This is terrible. And now, years later, cops love it because it actually documents I didn't hit the guy. And so I think we're just at the point where, again, the gut reaction is, I don't want you recording that. What are you going to do with that? Whereas now, we've got to educate people, and that's where I was talking to Todd Park and everything. I think we've really got to get out there and give grand rounds in every medical school, give grand rounds in every hospital, and talk about it's not bad to be transparent. It's not bad to be open and honest. I know it sounds kind of funny, but it's not. And yet, there's kind of a knee-jerk reaction. And again, I think it goes back to doctors feeling you don't like us anymore, you don't pay us anymore, you're telling me that patients like me just know as much as I do. You send people from Verona, Wisconsin, who are 23 years old to tell me how I've got to change how I write my notes, and they're all kind of snotty and act like I'm an idiot because I don't really know what a PHR is or what a Twitter is or whatever. I mean, there's a lot of, it's change management. It's cultural change, which is hard for all of us, and especially hard for testosterone-poisoned male men who are balding, who have been used to having everybody kowtow to them. I mean, I kind of miss it myself, to tell you the truth.
What's the timeline on integration and adoption of the electronic health record in non-Kaiser type of
It's a great question. You know, I used to be in Minnesota, and almost everybody but Mayo in Minnesota has Epic. But Epic at one hospital can't talk to Epic at another hospital, let alone Epic talking to McKesson, talking to GE, talking, you know, so I'll tell you what, the hype curve or the hype whatever, we always, what's it called? The hype cycle, which is very important. We always like overestimate how quickly it's going to happen, and we underestimate how important it is. And I think the other thing that Jane can talk about better than I can, or some of you can, is that again, this whole electronic medical record with hospital-based EMRs really, I think, is missing the boat. We may be wasting billions of dollars because it's all going to be on your cell phone. And yet, we're not doing that now. I mean, I go around to doctors a lot, and Jane's written a whole white paper on it. Almost all doctors have a Droid or an iPhone, but it doesn't hook up with their EMR in their office or the EMR in their hospital, and the IT experts in their office and their hospital won't service it and won't tell you what to do. So that's a big issue. So I can't tell you when it's going to happen. Unless you want to pay me to be a consultant, then I can tell you. But I don't think anybody can tell you because I think it's a big deal. And it's a big cultural deal. Because remember, my wife is on Epic. She's been on Epic for 10 years. It takes a year of a learning curve before it actually becomes useful and before you actually can use it and not feel like you have to waste a lot of extra time to use it. So the first 6 months you use a new electronic medical record, it's more work for the doctor.
Right, it was supposed to be, like, with the new legislation, then finally that the holding out organizations could no longer say, well, we don't know which brand or which architecture is going to become the universal. I came from.
But we still don't know.
I know, and I'm saying I came from.
And if Epic can't talk to Epic,
yeah.
Even if Epic was everywhere, it can't talk to each other. I mean, I'm not picking on Epic. I'm just.
Yeah, I was starting to get excited about it because I came from the VA system, and now to hear that it might be kicked down the road a little bit further is frustrating.
It'll be longer than you think. Yes, ma'am, in the back.
Hold on, Jenny.
Hi, my name is Jenny, and I blog at Chronic Babe. And Carrie, Six Until Me, and we had a pretty rousing conversation about this very stuff in our session right before this. And I'm wondering, as a patient, and just as you said, we are all patients.
Right.
What can you give us an example, because we were really kind of feisty about this in our session, of some language that I can use as a patient? Personally, my doctor relationships are great, but when I counsel other patients on how to ask their doctors or how to ask them, can I record this, or how to build that kind of relationship, can you give me an example of some language that we can use that physicians will hear and be receptive to?
Well, not all 800,000 American physicians will respond to the same language. I think behavioral economics, which Jane knows more about than I do, there's a lot of stuff that we can learn. I think it's a gradual thing. I, like Jane, won't go to a doctor that won't email with me because I travel a lot. So, you know, and I guess I know enough to be pretty feisty about that. But, you know, to me it's like just change doctors. I mean, you know, just go find someone who will. I don't think that's such a bad thing, and I think that we saw some data which suggests that others are actually subscribing to that. I mean, I'd be happy to talk offline on how that works. I've spent a lot of time with doctor groups, and they get very angry and everything. But again, I think that reframing the first initial anger as vulnerability may help you. Look, I'm a guy. I have no emotional intelligence whatsoever. I don't know why you're asking me this question. But you know, there's ways to actually learn how to do this stuff. I mean, the crucial conversations kind of stuff, which I've learned, and the Harvard negotiating kind of thing about difficult conversations. And I've actually gotten a little bit better, although many of the people that have worked for me don't agree with that. But I'm just saying there are ways to do it, and I think it's a really important question, but I don't think you can have one size fits all for all 800,000 docs in America. And you know, clearly pediatricians are a different phenotype than neurosurgeons or orthopods. Trust me.